Hi, and welcome to Basic Concepts in Medical and Surgical Nursing. This is Tracy Hansen, and I'm going to start our class off with the principles of perioperative nursing care. You can refer to chapters 16, 17, and 18 in your Iggy and Workman Medical Surgical Nursing Patient-Centered Collaborative Care. You also can refer to additional reading in your ATI RN Adult Medical Surgical, and those will be covering chapters 107, 108, and 109. You also will need to refer to your Perry, Hockenberry, Loudermilk, and Wilson textbook. And if you take a look on page 1251 through approximately 1255, 56, what you will be seeing are the pediatric variations in preoperative, intraoperative, and postoperative care, because we do need to encompass across the lifespan when we are getting ready to prepare patients for surgical procedures. This next slide that you're looking at is the objectives, and if you take a moment to get out your detailed student syllabus, you will see these objectives are listed out for you, and if you, this is going to be your study guide for this chapter or for this concept. And as you work through basic concept, advanced concepts within the nursing program, you will see that instructors utilize these, and they are a good resource and good tool for learning. So these objectives are listed out on page 16 of your detailed student handbook. If you look at the top of the right hand column, you'll see that it says identify the purposes of the Aldrich score, and there is a handout included with your notes, so you may refer to that as well, because there is not a picture of that in your Iggy book. So we're going to go ahead and get started and take a look at this concept map. And I think in just talking about this little concept map, it kind of gives you a great overview of everything that we're going to be discussing during and throughout the subsequent lectures. When you think about your OR or your operative client, there are many things that you need to consider as far as prepping them and ensuring that they're ready for surgery. There's great responsibility during surgery. And then post-operatively, again, it's going to be a time of great attention from the nurse, ensuring that we prevent complications. So if you would take a look up here at the age weight interview, what you will see are different things that you need to consider. Chronic health problems. You know, if you're taking care of a surgical patient that has congestive heart failure or chronic obstructive lung disease, you know, what are they going to be at risk for going into surgery versus the younger or middle-aged healthy person with no chronic health problems? There's going to be definitely different, you're going to need to adjust your nursing care appropriately to care for your patients. You need to consider current drugs that they're using, allergies to medications, what is their perception of the illness, what is their perception of surgery. That kind of dovetails into the psychological needs of our patients. We know that we build our understanding and expectations off of past events, and if you have a patient that is going to be having surgery and maybe say they've had a surgery in the past and it was a horrible experience, you know, what are they going to feel like coming in for surgery that day? You know, they're already set up thinking, this is going to be horrible. I remember that nurse had to stick me 3 times to get my IV. I remember I woke up and I had horrific pain. This is going to be bad. So when they come in with those ideas already, it's our job as nurses, because we take on an educator role, we need to educate them and try to alleviate some of that anxiety, try to discuss what their feelings are, how they're feeling. So those are going to be important things to remember when we're taking care of our patients. And then you can see right below there, we kind of talked about the psychological needs. We also need to consider their medications. So what medications are they on? Medications that they're on currently are going to determine what preoperative labs they need to have. what preoperative x-rays, maybe chest x-rays, EKGs. I'm going to talk about those types of things as we work through this operative period. And if you continue to go down, you'll see our little one as well as our older client. And so that's why I'd like you to read those pages in the powder or in the Loudermilk and Hockenberry Perry pediatric OB book, because we do need to pay attention to our pediatric population, because in this area, especially if you're staying around here, you'll see lots of tonsils, appendectomies, ear tubes. And then if you branch out and go to bigger institutions, there's probably going to be pediatric units, and you may have that potential to work with a pediatric client. So we're going to consider those pediatric and the older adult differences. And remember, with your pediatrics, you're not only taking care of a pediatric patient, you're also taking care of their parents. And, that can be a really stressful time for parents, so we want to incorporate them as a whole. And then when we move to the surgical side of things, sterility and safety, patient safety is always going to be your focus. And then in the intraoperative phase, the sterile field. So there's some little key points up there, and you have learned the technique of sterility. You understand how to apply sterile gloves. You've put in a sterile catheter. So it's going to be applying the knowledge that you have into surgical care and maintaining surgical asepsis. And then lastly, on this, I would like you to just take a look down at the bottom here. We have preoperative teaching as well as the consent. Those are going to be a couple of major things that we're going to focus in on. We want to make sure our clients have a great understanding of the surgical procedure, that their questions have been answered. You also need to consider what they know, and then validate, clarify, and reinforce information that the patient's already received, possibly from the surgeon or other members of the surgical team. And then if your patient has good understanding, they can sign the surgical consent. And what will happen is you will fill out which doctor will be performing the surgery. Your patient will sign it, and then you will witness it. However, as nursing students, we are not allowed to witness consents, but you will maybe be seeing your primary nurses do that. And then when you take the active role as RN, that will be part of your responsibilities. So this is just kind of in a nutshell everything we're going to be talking about during this unit. So let's take a look at Chapter 16 in your IGGI book, the care of the preoperative patients. And when we're talking about our preoperative patients, we need to consider the setting. Where are they having surgery? Are they coming in as an outpatient or an ambulatory surgery, which means they just come into same-day surgery, have the surgical procedure, are going to be staying less than 24 hours, obviously, and then being discharged home. So is it a specific same-day center in the hospital, or is it an ambulatory surgical center? They do exist where they just do same-day surgeries, and that's what they take care of. And then the flip side of that is the inpatient, and the inpatient refers to that patient that's already admitted to the hospital. Perhaps it's somebody that's coming in for a C-section. Obviously, we can't just do a C-section and send that patient home with a baby in less than 24 hours. That's not going to work so well. Also, it can refer to maybe the elderly client that is coming in with abdominal pain, and we get their pain under control. They continue to run tests, do diagnostics, and then maybe you see that they have a tumor in their colon or something. It can be for your open heart surgery. So there's a vast array of surgical procedures that can make your patient deemed the inpatient. The advantages of outpatient surgery, what are those advantages? As healthcare changes, we are trying to save money. So obviously it is very advantageous in cost containment. What are some other things that you can think of that are going to be beneficial to that patient in the outpatient surgery? Nearly half of all surgical procedures in North America are performed in ambulatory centers. So, with the improvements in surgical techniques and anesthesia, we are able to provide very high quality, very safe surgical procedures in the outpatient or ambulatory setting. The downside of the ambulatory outpatient is that maybe it is that older person who is coming in to have their gallbladder removed laparoscopically, but do they have the resources upon discharge to take care of themselves? You know, we know that our younger population, we heal more quickly, we have less comorbidities. However, that older client, we need to ensure that they have the resources necessary to take care of themselves. Or maybe you have a single parent, single mom, single dad, doesn't matter. And they don't have the resources to take care of their children once they get home. So a lot of that can cause stress, fear, anxiety, all sorts of emotions during the surgical time. So those are going to be things that we need to take into consideration. The preoperative period, as this slide says, begins when the patient is scheduled for surgery and ends at the time of transfer to the surgical suite. So when you think about that, sometimes patients are scheduled for surgery a couple of weeks out. Maybe it's an elective scope. Maybe it is a repeat scope. Um, Maybe it's putting that colostomy back together, making an anastomosis. You know, so maybe some of this stuff is scheduled a couple of weeks out. That is when that preoperative period begins, because that's when we as nurses, we start to educate that patient and help promote their safety. We will have a very good opportune time to provide patient education upon that initial visit, and that initial visit can really impact our patients. So we want to make sure that we understand what's going on. We want to advocate for our patients. If they aren't sure of something, then we need to discuss that with them, or have that surgeon discuss that with them. But we do need to be good advocates for our patients. And then it will end when we transfer that patient onto the surgical cot. So it can be maybe a matter of hours, minutes, or it could be up to a couple of weeks. So this is going to conclude this presentation. The next presentation, we will go into the assessment of our patient and getting them ready for that surgical experience.